what are some of the projects that you're involved in right now, and how do they interrelate to your job?
So probably over the past, I don't know, 3 to 4 years or so, I've really kind of shifted to doing more educational-based research. And that even more specifically has come down to developing at Duke, along with some colleagues there, developing an interprofessional course. And this course teaches the students psychiatry and substance use disorders. And so we have really developed this thing over the past 5 years to be more inclusive of other health profession students. So initially when we started out, it was medicine, and it was pharmacy students, and it was PA students. And then we went after and got some social work students involved because they just happened to be at Duke Hospital as well. And then from there we went and got some students from the Duke School of Nursing program. And so we started just adding in new health profession students into the course, and then we started adding in new faculty into the course. So like it was just me and the psychiatrist who were really doing a lot of it. And then we started adding in, we added in some people from the School of Nursing, and we added some folks in from the PA program. We added in an actual nurse who worked on the inpatient psychiatry unit. So we brought all this new energy into the course, and it was really cool. And so we've been working on developing the course, and as part of that, we've been collecting a lot of data off the course as well. And so we've published a couple of papers. We have a couple of papers that have been accepted, which is very exciting for us to have our work get out there and get recognized, because we think we've developed something that's pretty cool in that we're taking students past the level of just like, here's a knowledge or here's an attitudinal change. We're actually taking it to the level to changing behaviors, and one level further in influencing patient outcomes. And so this last iteration of our project really is targeted at like, we want students to have a better approach to interacting with patients, and that interaction with their patient is them providing counseling to somebody with a substance use disorder. And then the step further from that is then we ask patients a series of questions about what type of behavior change do they want to make now. So like if you're smoking, if tobacco use disorder is your substance use disorder, and you want to quit smoking, one of the questions the student will then ask you is, would you be willing to call the North Carolina Quit line? Mm-hmm. And then the patient would say like, no, get out of here. I don't want to talk to you. You know, like I'm tired. I don't want to be done. I want to be done with this. Or they'll say like, yeah, I'd be interested in calling the Quit line. Or yes, I'd be interested in speaking to somebody about nicotine replacement therapy. And so we took it to that level. So, you know, this is all something called Kirkpatrick's hierarchy of educational outcomes, and we took it to the highest level. And when you look at the educational literature landscape, no one's really doing that. Everybody kind of captures the low-hanging fruits, which are like, I pre-test you on your knowledge, I post-test you on your knowledge improves. You have a really bad attitude, we give you a bunch of education, your attitude improves. But so we did all that, but then we also said like, here are patient outcomes. Mm-hmm. Now we didn't take it to the furthest step to see if patients actually followed up, but we took it to the level of like, did the patient agree to do something? Because really, that's a big step for a student, to be able to go to a patient and be comfortable and talk to a patient about their substance use, right. And have that patient actually sit there and listen to them, and actually give them an answer like, yeah, based on what you're telling me, yes, I'm willing to change a behavior. We also taught the students before they did that how to do behavioral change counseling. And we had this nurse who's a phenomenal nurse. He does a great job, and he rounds on our stress management team now at the hospital, but he sat there and provided observation of the students and then gave them real-time feedback. And he is like an expert in behavioral change counseling. So it's been, you know, it's really, I mean, been this really cool thing that has just developed over like 5 years. And we just keep bringing in these different elements, and it just keeps gaining momentum and energy and excitement around it. And we're at the point now where we're really just trying to push it out into the world so that other people can see what it is that we've done. So we have some papers, and then we're presenting it at some workshops at different conferences and stuff. So we'll see what the public has to say.
Thanks for watching this short clip from our Pharmacy IR podcast. To watch the full interview, you can check it out on our YouTube channel.
And to make sure you don't miss anything, sign up for notifications on our Facebook page and like and subscribe anywhere that this podcast is offered.